Welcome to The Explainer. Today, we're diving into a really challenging clinical scenario, central giant cell granuloma. It's this benign but, often incredibly destructive lesion of the mandible and maxilla. We're going to be exploring a brand new protocol that could totally revolutionize how it's treated, giving better outcomes while minimizing disfigurement. All right, so here's how we'll break it down. First, we'll get a handle on what exactly CGCG is. Then, we'll look at the big problem with treating it. After that, we'll introduce this new protocol, check out the results, and finally, talk about what this could mean for the standard of care.
So, first things first, let's get a really clear picture of the pathology we're dealing with here. Okay, so central giant cell granuloma, let's just call it CGCG, is this localized, benign lesion that eats away at the bone in the mandible and maxilla. The exact cause, well, it's still a bit of a mystery, but we do know it's full of these osteoclast-like giant cells. Now, here's the kicker. Even though it's technically benign, its behavior can be anything but. It can be super aggressive, posing huge challenges because it's actively destroying bone. And, this is a pretty rare condition. We're talking an incidence of maybe 1 to 2 cases per million people each year. It mostly hits patients in their teens and 20s, which makes the long-term effects of any treatment, especially for younger patients, a really critical thing to think about.
Now, here's where it gets really interesting clinically. There are 2 very different versions of this thing. Most cases are non-aggressive. They grow slowly. But about a third of them are the complete opposite. The aggressive form grows fast, causes a lot of pain, chews through bone, and it has a nasty habit of coming back. This is the one that often leads to serious facial disfigurement.
So you can see how this aggressive behavior creates a huge dilemma for surgeons. And that brings us right to our next point. This constant battle between effective treatment and, preserving the patient's face and function. For a long time, the go-to treatment for aggressive CGCG was pretty radical: extensive resection. Cutting out large portions of the mandible or maxilla. It works, sure. It keeps the lesion from coming back. But the cost to the patient, especially a kid, can be just devastating. The alternative? Well, there are less invasive options. Things like steroid injections, calcitonin, or denosumab. They save tissue, but the recurrence rate is just sky high, sometimes up to 72%. It's a real catch-22. And this quote from the source material really just nails it. It perfectly captures what everyone's been searching for: a treatment that can stop this thing in its tracks without destroying a patient's quality of life. So, a recently published protocol out of the Medical University of Łódź in Poland tries to solve this exact problem by combining a bunch of different techniques into one smart, minimally invasive strategy. Okay, this is the core of it. It's a multi-step, multimodal attack plan. It starts with pharmacology. They use weekly steroid injections right into the lesion to shrink it down. To do that, they create a tiny little bone window for access. Once it's smaller, they go in surgically and remove what's left with curettage. Then comes the really critical part. They apply a chemical agent to kill off any microscopic cells left behind. And finally, they reconstruct the area with a bone graft and platelet-rich fibrin.
And that chemical agent is Carnoy's solution. This is a key part of what's new here. It basically lets the surgeon do a chemical cleanup, destroying any tiny tumor cells that might be hiding in the little nooks and crannies of the bone. So you get the radical effectiveness of a big resection, but without actually having to remove all that healthy tissue. It's a game changer.
But, the big question is, does it actually work? Let's take a look at the clinical evidence. They tried this exact method on a group of 13 patients.
The results are, they're pretty incredible. They followed these patients for up to 6 years, and out of all 13, guess how many had a recurrence? Just 1. And what's really impressive is that the protocol worked great across the board. It didn't matter if the lesion was aggressive or not, or how old the patient was. And most importantly, it did exactly what it was designed to do. It preserved the structure of the mandible and maxilla. Plus, the complications were all minor and temporary, things like a little bleeding or some temporary numbness. The visual proof is just so powerful. In one of the cases they highlighted, you can see the scans. You start with this huge destructive lesion in the front of the mandible. Then you see it shrink way down after the steroid injections. And finally, you see the bone 3 years later totally healed and reconstructed. It's amazing. Now, the study was also really smart about identifying risk factors. That one patient who did have a recurrence, turns out they had a low serum calcium level.
And the data also showed that if the initial lesion was really big, or if there was a lot left after the injections, the risk was higher. This is super useful, right? It tells us that patients with these factors might need to be monitored a bit more closely.
So let's pull all of this together in our final section and really think about why this protocol is such a big deal. After looking at the problem and seeing this evidence, you have to ask yourself, okay, why should this be the new way we treat CGCG?
Well, the answer seems pretty clear. It's because this protocol gives you the best of both worlds. You get the super low recurrence rate you'd expect from a radical surgery, but you get it with the safety and tissue-saving benefits of a minimally invasive approach. It really seems to solve that core dilemma we talked about at the beginning. It's a practical and frankly a superior way to handle this really tough condition.
And that leads us to one last thought to chew on. This protocol is a fantastic solution for CGCG, for sure. But it also makes you wonder, right? Could this whole paradigm, using medicine to shrink, surgery to remove, and chemistry to sterilize, could this be a blueprint for treating other difficult lesions of the mandible and maxilla? It definitely opens up some exciting new possibilities for the future.